And if you're a veterinarian who's a feline vet, or you see any amount of feline patients, you know that they like to come with more than one disease.
There is just no cat with one disease.
Not for long anyway. You just wait 5 minutes and they'll get another disease, right?
Right.
Yeah,
exactly.
so we know that that's our daily life, so it's really cool.
Good.
Sorry for saying sorry. Media presents the Purr Podcast, the best podcast for feline medicine and surgery with tips, tricks, and updates for the entire veterinary healthcare team. If you're dying to know more about cats, keep on listening. Here are your hosts, Dr. Susan Little, famous cat vet and textbook author, and Dr. Jolle Kirpenstein, talented surgeon and social media geek.
Hi, this is Dr. Susan Little.
And Dr. Jolle Kirpenstein.
And I just surprised you, didn't I?
I know you did.
Because every time we start the podcast, Jolle looks at me and I'm like, and then I go dead and I don't know what to say.
Yeah, she went really fast this time. And this is the Purr Podcast, by the way.
It is. Mm-hmm. And we're very lucky today.
And why is that, Dr. Susan?
Because we have a special guest with us.
We have a very special guest.
Yes.
And the other thing is we're a very special place.
We are in a special place. Yep, absolutely. You've been here more than me. We're in San Francisco.
San Francisco for
the American Association of Feline Practitioners Annual Conference, which is like the place to be.
In?
Feline medicine.
Oh, yeah, of course.
Mm-hmm.
Yeah, where else?
Yeah.
And what does that have to do with our special guest?
So our special guest is Dr. Apryl Steele.
Yay!
Welcome, Apryl.
Thank you. I'm so glad to do this and to be here.
Apryl is the current president.
The president,
For
el
AAFP.
presidente.
Yep,
Yeah.
such an honor.
Yeah. How many people are in attendance this year?
Oh, I knew you were going to ask me
Yeah,
that.
like roughly.
1,500?
No kidding.
We
That's
are higher
good.
than we've ever
Yeah.
been. We were about 18% over expectations coming into this last week. It's been amazing. The interest is outstanding.
I knew it would be more, but I had no idea it was that much more.
Yeah.
Because the last couple of years, we've had increasing attendance.
Right.
That's
It's
amazing.
been going up every year. And I think the topic of complex disease, so not just having one disease, but when you have multiple diseases at the same time, we don't talk about that too much in veterinary medicine, but we face it every single day. And when one treatment exacerbates the other condition, it gets very complicated. So I think that resonated well with people.
Yeah, it's a great topic. So AAFP always has a theme for their annual conference.
Not surgery, sadly.
It has been. Next year is head and neck, so there's going to be surgery to head and neck.
There's
And-
room
and-
there, Yola.
Excellent. I know,
Yeah.
head and neck is good.
Yeah. But I think this is the first time we have focused on like concurrent and complex disease management, right?
Right.
And if you're a veterinarian who's a feline vet, or you see any amount of feline patients, you know that they like to come with more than one disease.
There
It's
is
just
no cat with one disease.
Yeah,
Nope, that's the
not
thing.
for
Let's
long
just
anyway.
change it.
You
Let's
just
just
wait
change
5
it.
minutes and they'll get
Yes.
another disease, right?
Right.
Yeah, so
Exactly.
we know that that's our daily life. So it's really cool
Good.
that we finally have a meeting focused on this.
It's good. And it's been interesting because the willingness of the presenters to redo their entire presentations for the subject, it's not an easy thing to do. And many times they have to consult with other people that have a little nuance or treat that other comorbidity. So it's been very interesting.
Yeah, because we typically don't lecture like that, right? We lecture like only about kidney disease or only about arthritis, but we don't often lecture where we combine them.
Right.
So
the
does
real
it-
world.
The real world.
The real world.
Which is the way it should be. It's really the way it should be. So yeah, so I know it's a challenge for people, but it's good. Maybe it will also help us foster more presentations like this where there's
That'd be great.
multiple diseases in a presentation. So we know that you're very busy because this is the annual meeting and it's there's so many people here and it's going well. So we're very happy that you can spend some time with us talking about AFP and stuff.
Yeah, and give a little
Fantastic.
bit of background.
Yeah, tell us about
Where
yourself.
are you from?
Yeah.
Myself.
What's your
So-
story,
What's
April?
your story?
I'm from Denver, Colorado. I am born and raised, and I went to Colorado State University and had a little sidetrack to the veterinary corps in the Army and during Desert Storm, and then came
wow.
back and I started my own practice 2 years after I graduated from veterinary school, and I practiced for 16 years, a very cat-friendly practice in Denver. And about 4.5 years ago, I was asked to be the successor for the CEO of a animal shelter in Denver called the Dumb Friendly. And so I took over that role about 1.5 years ago and sold my practice. And now I advocate for cats and dogs in a very different way. But it is definitely my passion.
Wow, that's amazing. So let's go back to the beginning, Desert Storm.
Yes, it's not as dramatic as it sounds in that I was a food inspection specialist.
Okay.
And mostly inspecting food going over. Most of the time I was in Stockton, California, which during Desert Storm had more murders than Americans dying in Desert Storm. But that was just
that's an interesting statistic.
Yeah, that was an interesting statistic.
Stockton, California. Where is that?
Where's it near?
It's Lodi, do you know? Not too far from Sacramento in the San Joaquin Valley.
Well, but so I know it may not sound exciting to do food inspection, but it does point out the fact that veterinarians do a lot of things, right, other than just like treating animals, and that it is important to do food inspection after all.
It's very important.
Yeah.
It is. And how many veterinarians do that in the Army? What's the estimation? Do you know?
I have no idea. I know the Army does it for all of the services.
Yeah.
So it is all within the Army, but I just don't know that number.
And it is, obviously it's really important to do this, to be able to guarantee that the food that
Safety.
people eat.
It's hard to fight a war if you're sick.
I know, that's exactly it. So
Indeed.
that's amazing. So, and it shows how important it is, how important our profession is, because you can go anywhere, really, if you think about it.
And it's part of One Health.
And it's part of One Health.
Yep.
Absolutely.
Human and animal health together. Yeah, and then so you opened your own practice. Always a brave thing to do, huh?
Yeah, it was lovely. It was so much fun. And if I didn't know what I needed to know, but that was probably a good thing.
You never do. You might have
You would never do it, right? But I'm so glad I did. And it was in 1999, and it was when I bought it, it was a cat-only holistic practice. And I was a traditional medicine veterinarian that served cats and dogs. So I did the blasphemous thing in the AAFP and made it from a cat practice to a cat and dog practice. But even 17 years later, we were more than 60% cats. So it was a very cat-centric practice. And lovely clients would do whatever they needed to do. It was a cat-friendly practice at the gold level and just really care deeply about those relationships with our patients and our clients.
A species fluid practice.
A species fluid practice.
I like that.
There you
I
go.
like that, with a focus on cats.
Yes.
So it must have been a hard decision to leave that and go to Dumb Friends League.
I bet, yeah.
It was, and I actually declined the opportunity 3 times.
Really?
Mainly because I like to say I was in my box. I was thinking in this box of I am a veterinarian, I heal, I love surgery.
This is what I do.
This is who I am and what I do. And I've always respected the Dumb Friends League. And I have to say, for people that don't know the Dumb Friends League, dumb is not that they're not smart. It's that they don't have the power of human speech, and we speak for them. And we've been around since 1910, and that was a common use of the word dumb back
at that
there.
time.
So yes, you are hearing me say Dumb Friends League.
Quite a lot.
Quite a lot.
And it's good that you say that, because the first time that I heard about it, I was like, what a dumb name.
Right. I hear it often.
But then it is also really to remember. So it's different than any of the other names that we encounter quite a lot. And so it's stuck.
Yeah, it's an uncommon use of the word, but
it is now.
Nowadays, yeah.
But finally, I realized I could be impacting 22,000 animals a year that don't have advocates. And every one of my patients had an advocate, and they were going to get care whether I was the one giving it or someone else was the one giving it. And that's what convinced me to this. And it's amazing to lead a team of 280 people serving animals in our community.
That's awesome. That's
lovely.
awesome.
It is awesome. And people like you who take on that challenge, because it's a challenge and it's really shifted you out of your box, right?
Yes.
Yeah, my hat is off to people like you who do that. So
thank you. Yeah.
We need more.
Going back to your clinic, what were some difficult things that you had to deal with owning a practice?
Ooh.
I think it wasn't the medicine or the surgery, or it was always staff.
Staff.
Always.
Yeah, I can tell 2 clinic owners go, staff.
Yeah. And learning the lesson, I ended up with an amazing staff. I can't tell you how wonderful those people are. But it took figuring out that teams, in my experience, tend to manage down to the lowest common denominator instead of rising to the highest. So you get to choose where that lowest common denominator is. And if you're tolerating misbehavior and tantrums or whatever that is, lack of accountability, that's what you're going to get. And once I figured that out, it was a lot easier. I had been in practice for 6 months, and I was audited by the city of Denver.
Oh my!
So, and it was the auditor's very first audit, so he had to find, he had his book out, and he was trying to find every little thing. The good news is that they owed me money after the audit, and I learned a lot, so I didn't have 10 or 18 years of this misinformation that I built upon. So it actually ended up being a blessing in disguise, but incredibly stressful when you just start a practice.
My God.
I think something that you said really resonates with me, and it goes back to the sentence, if you build it, they will come. So if you build an environment that is good, you will attract certain people that are,
Yeah. And if you have the not good, those great people don't want to stay. They don't want to live that every day.
Yeah. But here's the hard part, right? Like, we don't get trained for that in school. No, we all learn this on the job, don't we? And you either figure it out or you don't, and it takes time, and it's a process. Or
you hire someone that's really good in this.
Well, in the beginning, you probably can't afford to hire someone, right?
True.
I have one quick story that it does stick with me from my beginning years. Is I had a small staff, so we had 3 technicians and 2 receptionists, and one of the receptionists was new, and she found out that there were some unethical things that the technicians and the other receptionists were doing that were black and white, not acceptable. So I had to fire my entire staff in one day, except for that one receptionist. So, and it was a decision. It was that kind of moment when you say, do I have these ethics or do I not have these ethics? And I know this is going to be a very hard day, week, month if I do this, but it was the only real decision I could make. Put the phone up and say, hit intercom 10 if you need us. We're in surgery. You just make it work.
You cope. Yeah, that's the beautiful life of being a practice owner, right? It's having to make the tough decisions like that.
But I encourage veterinarians to become practice owners. I think it's the way to make veterinary medicine progress, because you can really institute your great ideas and change things. And it was really good. I could sell my practice, and that's my retirement. And it's the best way, I think, to have a career.
Hard work, but it's very really the classical way to be a veterinarian, isn't it? And it's still a good way to be a veterinarian.
Just believe you can and say yes.
Yeah, absolutely. Yeah. When did you get involved with AAFP? How long ago?
It's probably been about 7 years ago.
Yeah.
It's been a while now.
Yeah.
And I just came in as a board member and became the delegate with the AVMA representing the AAFP, which I'm still doing as well. Right. And then, I went through the leadership process. This is my president's year. And it's been great. It is such an amazing experience to be part of the leadership of the AAFP.
Yeah.
But before we go further with the AAFP, I want to go back to Dum's Friends League first, if possible, because I think that we have a lot of fun things to talk about AAFP and some new things too. We're going to talk about. Very exciting. So you move from a practice, being a practice owner, to leading a shelter organization. And I am always impressed with you and Dumb Friends Leagues in general, the amazing relationship that this shelter has with the veterinary profession. And that's not the same everywhere. And this is something I really would like to talk about a little bit. So
absolutely.
How did you all do it? Because obviously your predecessor did a lot there too. How do you create a relationship like that? Because shelter is not the enemy.
Right. Shelter is the biggest source of pet acquisition, so it's the source of your patients. It's about trust. I mean, as is any relationship, right? So when I was president of the Colorado Veterinary Medical Association and interacting with the Dumb Friends League from the veterinary perspective, and now it's flipped and I'm on the shelter side interacting with the veterinary community. I feel kind of hypocritical how to say that. Like I have 2 personalities when I talk about the 2.
Yeah.
But it's really about trust, honesty, transparency. I traveled all over the country when I took this role to learn about sheltering and animal welfare organizations, and these relationships shock me. What I saw, there are many states that actually have legislation, and many of your listeners probably know this because they live there, where a nonprofit organization isn't allowed to do any procedure on an owned animal, even an owner requested euthanasia for someone that has no money to provide that for their pet. And or if you adopted a female dog that you think is spayed and it turns out that it wasn't spayed, you can't do the surgery. It puts so that is obviously an area where there's been a lot of mistrust. and fear. And the interesting thing is when I had my practice, and it did become a 5-doctor bigger practice, it was great, high-end practice. I was the closest veterinary practice to a subsidized veterinary hospital just down the street. And it was for the underserved community, highly discounted fees. There were 2 other really low-cost clinics near me, and that helped me do my work best. And there was some economic models being done and a paper being written right now about how having a low-cost or subsidized veterinary hospital near you, if you're a high-quality relationship-based practice, actually improves your bottom line, does not take away from what you are doing. It's a matter of understanding that there's different populations, right? So there are the clients that are going to come to and be able to afford to pay for their veterinary care. That's let's say the top third. And then the bottom third are people who would never be able to pay for that care. Some of them don't even know that veterinarians exist. This is truly a different population. It's not a client that's getting lost or stolen. It's an animal that's getting lack of care and suffering because nobody is advocating for that animal. And so those 2 tend to be non-controversial.
Yes.
But when you get that middle third,
the gray zone,
that's where there's potential for clients, those people to become clients to some degree, and especially if the veterinarian's willing to meet them where they are and give them different treatment options. And then there's some of those people that still can't quite afford that. So that's, I think, where the contention comes, and that's why there needs to be trust and that everyone's making the right decision for those.
And how long did that take in Colorado to ensure that trust? Because probably didn't happen from yesterday to today.
I mean, I really believe the relationships between my predecessor, Bob Rohde, and then Ralph Johnson was the executive director of the CVMA for many years. Probably, it's a 10, 20-year process. And that's what people get frustrated with but that doesn't mean you don't start it. And and I'm sure it can go faster if you're, we were going to do a cat spay neuter clinic because we see a lot of cats. And instead of just opening it like we wanted to, we went to the Veterinary Association. They surveyed their entire membership. And the membership said 85% said they would be neutral support or strongly support us opening a free cat spay neuter clinic with no questions asked. And when they got that data, they said, okay, then we're going to support you, and you can actually lease space in the headquarters of the CVMA. So it was this relationship. It took us an extra 2 years to open that, but we had the conversation, we were patient, we got buy-in before we did it. And I think that's key.
And the bulk of the cats going to that probably would never have been spayed anyway.
Right, and we did 12,000 last year.
That's amazing.
Yeah, so really it shows that you need at least a couple of visionary people that see further than, tomorrow.
The box.
And then you need to have patience and time. So it's a really nice example of checking off some boxes before you jump into something and then making it super successful. And I agree with you. I think that, a lot of the shelters, especially now, a lot of people go to shelters. They're moving a little bit away from breeds itself. They want to have a shelter animal. And then if you can strengthen that relationship between the shelter and then the veterinarian, where a lot of these patients will go to too, that's beneficial. It's synergy between the two.
And one more piece of advice for that relationship, because this was really key for us, is you can find jerks on both sides. You can find veterinarians that are not nice, and you can find animal welfare leaders who aren't being ethical or aren't being nice. Those aren't the relationships that you want to form, right? So don't let one experience taint your willingness to have these conversations.
Right. The animal sheltering world is a big world. It's a varied world. And there's lots of room in there to develop relationships. Yeah.
So anybody can go to that cat spay clinic to get their cats?
Anybody. We know that cats, the overpopulation of cats are still what we're struggling with. And we know that cats that are let outdoors don't care if you're feral and you're tame and you're a community cat. They do their thing. And so it's biology. We realized that to really impact this, we had to take away barriers. And so we're not seeing and it's just it's self-selective. It's not it's in a very poor part of town, so that's one geographical selection. But we're not seeing wealthy people coming in. They want relationships, right?
Yeah.
They want to have that long-term.
They have different expectations.
Exactly. Yeah. We're seeing the animals that we're not getting spayed and neutered previously.
And so doesn't matter what age they come in, or
well, as long as they're 2 pounds.
2 pounds. 2 pounds or bigger. That's it.
Yep.
And then they get spayed. And what is
spayed, neutered, and core vaccines?
Okay,
for
so
free.
Everything for free. And so you probably get some support for that too, I guess.
We're ending the 3rd year of the program, and we funded a 4th of it through the league, a 4th through the Animal Assistance Foundation, which is a grant-making group in Colorado. PetSmart Charities and ASPCA partnered with us.
Wow.
So now that those were 3 years commitment. So now we have to figure out what's going to happen next.
Yeah.
No, I understand that. I understand. And do you see a decrease in feral populations and that sort of thing? So you have some data supporting that this is the way to go?
Right. So we're having to look at what I call surrogate data. So it's hard to go count cats. I mean, the DC Count Cats, a project that's, in millions of dollars to do. And it's just a very difficult thing. We don't have that capability well right now. So what we're trying to look at is juvenile cats coming to shelters in the Metro Denver area, because juvenile being that there's kittens happening and the intake, and we are actually starting to see a decrease in that. And it's gonna, it's a huge population, and anyone who's looked at population studies of trying to address cat overpopulation realize it's a very challenging thing, but we can't wait to see how this comes out as we get more and more cats spayed everywhere.
Yeah, and it will take time.
Yeah,
it will take time because you have to reach, almost a certain level, right, in order to make change.
70% plus.
This is awesome. We're already at 25 minutes.
Wow.
Can you believe this?
We haven't
talked about AAFP.
No, not yet, but
we have another podcast.
We have good news. You'll be back.
That's all AAFP.
Right.
Yeah. We're not letting you get off the hook that easily.
It's kind of crazy how quickly these things go.
I know. We get chatting and then it's like, we're out of time, which is why we
do
do more
than a lot.
That's why we do more than one podcast with people. So
we chat a lot too.
We do. But that's the fun part.
It is. So thank you so much.
Thanks so
for
much.
My pleasure.
A wonderful first podcast, and we'll see you in 2 weeks.
All right. Sounds great. Thank you.
Dr. Susan Little is a feline medicine specialist with 2 cat-only hospitals in Ottawa, Canada. She is best known as an international speaker and as the author and editor of 2 textbooks, The Cat, Clinical Medicine and Management, and August, Consultations in Feline Internal Medicine. Along with 3 cats, she also admits to owning 2 dogs, and you can follow her on social media with the handle @CatVetSusan. Dr. Jolle Kirpenstein is a diplomate of the American and European College of Veterinary Surgeons and a big cat fan. His specialties range from surgical oncology and reconstruction to minimally invasive surgery. He is the author of 2 textbooks on basic and reconstructive surgery. Did you know he was allergic to cats? Jolle works currently at Hill's Pet Nutrition. You can follow him on social media with the handle @GBETSX. The opinions of this podcast are those by Dr. Susan Little and Dr. Jolle Kirpenstein. Veterinary medicine is a complex profession, and often there are multiple diagnostic and therapeutic options for different disease processes. If you're a pet owner with questions, please go to your local veterinarian. If you're a veterinary professional, ask your questions on our Instagram page @Purr Podcast.